So Dom, what would you say is the most interesting part about your clinical role?
I think the best part about it is the autonomy that's involved. I find that once you go into the specialty a bit more, you tend to learn about the different types of procedures, the equipment that's used, how different doctors work, and obviously trying to mold that all together and become basically one of the seniors in the room and be a part of the decision making that's involved, and really be involved as part of a team.
How long would it take for someone to, on their first day in angio, for them to become basically proficient enough that they feel comfortable taking over that part of the department?
Because of the vast number of procedures that we do and the different doctors that may rotate day in, day out, or even on a weekly basis, I would say a good structured, maybe 1 to 3 month program would be sufficient. And that would allow them to observe most of the procedures, have some sort of assistance performing those procedures, and then confidently perform those independently.
Okay, that's less than I would have thought, which is encouraging.
Yeah.
Now, would you say after those 3 months they get a general overview of things, or they basically one can expect that they'll be pretty proficient in most of the types of scans that are done?
Pretty much confident enough to perform those procedures on their own and hopefully to have seen some of the complex procedures as well. And that's when you really get the test of how that radiographer performs. Can they handle the pressure? What time of day are they doing this procedure? It could be after hours, on call, on the weekends. And then, of course, be able to adapt to those situations. And then from that, you can use that knowledge to be able to adapt it to even other emergency procedures or other more complex procedures that they do see.